I just want to say a few thank yous as we got this program together. This has been a lot of fun. Thank you to Hofstra for hosting us and anybody from Northwell who's here for your support. I want to thank Mark Lee, all the editors at the Journal of Climate Change and Health, CC, and Hallie Campbell right here. Who I swear, we have like a whole team that does this at Sinai. She did this all herself. So congratulations and thank you to everybody. Okay, so our topic is going to be sustainability for health and lifestyle. We have 3 speakers, 2 in person, 1 virtual. I'm going to introduce them all at once, and then we'll get started, and they'll just come up one after the other. So the first speaker will be Dr. Laura Geer. She's an associate professor and chair in the Department of Environmental and Occupational Health Sciences, SUNY, not CUNY, Downstate School of Public Health. Her topic is going to be Brooklyn Resilience from Heat with Youth Citizen Science. And she'll give us the topic on that. Okay, after that will be Dr. Sheetal Rao. She's a practicing board-certified internal medicine physician whose work explores the impact of climate change on health. She's a 2022-23 University of Colorado Climate Health Policy Fellow and a FEMA Extreme Heat Fellow. She practices and teaches at the University of Illinois in Chicago. And you're not going to see our final speaker till they actually present. So I'm just going to go ahead and introduce Dr. Ratika Samtani, Assistant Professor, International Institute of Health Management Research. And the topic will be millets, a step towards a sustainable future. And we'll meet that person as soon as their slides come up. So I'd like to ask Dr. Geer to go ahead and begin.
One more super quick housekeeping, if anybody's just joining us. If you look in front of you and you see the little microphones, if it is green, that means you are projecting and people can hear you. Also, when you are giving any feedback, you'll have to hold it down to be heard. Thank you.
Wonderful. Thank you so much. I just wanted to thank the conference organizers. So happy to have all of the participants in the audience today and the fellow presenters who presented earlier with very engaging talks. Thank you. And also briefly, I have no conflicts to declare with this presentation. I'm going to talk to you today about a pilot study that we implemented in the summer of 2022 on Brooklyn resilience from heat with youth citizen science, and I will refer to it as our BRIC study. Briefly, we had a team from the School of Public Health, Dr. Lori Hepner, Dr. Daniel Elke, and working in the design and some of the implementation of the study. We had members at the Arthur Ashe Institute for Urban Health. They're housed on our campus, and they sponsor a health science academy with high school students. So those are members of our team. I'll share this slide at the end as well to acknowledge all the study team and some student coordinators and some external partners, including Sarah Slack. She's an 8th grade science and STEM teacher who's involved in looking at heat resilience and working with youth on that topic. So briefly, an introduction on extreme heat within New York City. It's well documented that the frequency and duration has been on the rise with extreme heat events due to climate change, especially in inner urban city communities. You see the depiction on your right of a thermal imagery map. I'll help you with where we are located in Brooklyn, where we experience some higher level of heating due to the built environment, infrastructure, re-radiating the heat that it's absorbed. So there's a bit of less cooling due to, the protective green structures around. Some of our most vulnerable communities when it comes to heat-related illness, and including mortality, include older adults, as you would know, and those with chronic conditions, such as, in particular, diabetes and obesity, those with mental health illness, and younger children and pregnant women. So New York City has a plan, Cool Neighborhoods NYC, for climate adaptation, to respond to and to address heat mitigation strategies. They use a heat vulnerability index, and it was developed using environmental and social factors to determine vulnerability to heat mortality. So I'm going to refer to that. That was inspirational behind us designing the BRICS project. And just to point out the significance of built environment features, such as lack of shade-producing vegetation on streetscapes, contribute to Brooklyn in particular's disproportionate health impacts from heating events. So the HVI map is depicted for New York City community districts, and you can see that there are some moderate to high vulnerability areas in our study area of interest. And you'll see this little logo, the RISC, that represents the Resilient Schools Consortium project, which was implemented in 2016 through 2019. And it was a partnership focused on middle school students between Brooklyn College, the National Wildlife Federation, and the Science and Resilience Institute at Jamaica Bay, also funded by New York Sea Grant and 6 Department of Education public schools. And they worked on a project with youth on resilience to climate. So we're very interested in some of the factors in the design of the BRICS study that lead towards a community's resilience from extreme heat, the various social factors and physical environmental factors. I've referred to a few of these already. So the objectives of our study was to partner with a trusted organization representing community, the Arthur Ashe Institute of Urban Health. And I had mentioned they sponsor a health science academy to expose high school students to some skill sets and careers in the health sciences. And we designed our study partnering with them to build community capacity with youth around assessment of climate-related heat impacts and resilience in underserved urban communities. Our first aim of the pilot was to implement a cross-sectional survey. And we actually, I'll tell you the details of that in terms of how we leveraged some materials from the RISC project. So we implemented a survey to the students in the summer program through Arthur Ashe. We also implemented a training program to the students to sort of help build their environmental health literacy around and expose them to climate-related potential career paths, and taught them through these programs some geospatial aspects of assessment of heat exposure, including training in the collection and mapping of data. Our third aim of the pilot study was to have the students go out and conduct their own residential heat temperature sampling. And this, we utilized access to a subset of the Health Science Academy students. They were funded by the Doris Duke Foundation. So they're the Doris Duke cohort students. So there were 65 students in the summer program in the summer of 2022 when we implemented the pilot. So those 65 students were invited to complete the survey on perceptions around climate and, general preparedness in their environment for responding to climate-related events, including heat. We also invited the parents to participate in the survey. The students in the Doris Duke cohort, the cohort, there were only 14 students in that cohort, and that's where we worked very closely in the trainings on, geospatial assessment of heat, and worked with the trainings in terms of having them use the samplers. And all the students in this program in general, the HSA program, represent underserved communities in the Brooklyn area and are racially and ethnically diverse. And the Arthur Ashe Institute it's housed within our institution, even though they're independent from our institution. So there was a fantastic opportunity for this collaboration. So as I had mentioned, we implemented a short cross-sectional survey at the beginning of our program. So this was across not only the small cohort that we were going to do the trainings with, but program-wide in terms of the 65 students attending the summer academy. For the second aim, we leveraged some experts in geospatial assessment and climate data tools to participate in our trainings. We delivered the trainings in about 6 different class sessions with the Doris Duke cohort of the Health Science Academy. We gave them, we trained them in collection and mapping of the geospatial tools for assessment of data on climate, health, and community level resilience in Brooklyn. And we evaluated the training with a satisfaction survey with the students. So the third aim was the interesting and fun challenge, where we gave them this little device that they could bring home with them to perform sampling. The students co-developed a sampling protocol. So that was really another level of engagement that we had by the students, sort of building their skill sets, their STEM skill sets, and further enlightening them to their potential role in climate-related careers down the road. We did a little pilot around the campus where, we had them all using their devices, collecting data, and then we went into the classroom, before we set them out on their little assignment to do their own sampling, which took place in their residences and neighborhoods over a 2 to 3 day period. And we would email them prompts to, monitor at similar timeframes. And we talked about the different categories of things that they might want to sample in terms of being concerned about temperature. And one of the inspirations behind this project was thinking about, heat equity for underserved populations who are living in areas with, fewer built environment protections from heat exposures. Some of the information that we receive about what the actual temperature is outside is from a stationary monitor that might be at an airport, or so what's the heat on the ground? What are people actually experiencing? It's very, very important to consider in terms of resiliency and ability to respond to heat. Here's a brief snapshot of the demographics of our cohort, predominantly female, in terms of who completed the survey, that initial survey in aim 1. High school age, predominantly African-American. Borough of residence was quite interesting, mainly in Brooklyn, but when we broke it down by neighborhood, nearly 20% were from Canarsie, which is along the water. We thought that was interesting because they may have, when they were very young, they may have recalled experiencing impacts from Hurricane Sandy. So all those types of things inform some of the types of perceptions questions about had they experienced climate-related events. So that's sort of interesting to really understand who's responding to the survey. And 79% reported being US born, which is actually much higher than some of the clinical populations, where nearly half report being non-US born. And then the average length of neighborhood residence was around 12 years. So just showing you sort of a preliminary snapshot of the types of things that we were asking about in terms of, you know, have you ever experienced these events in a neighborhood? So this is sort of an all that apply type of question. So severe winter storm. What are your highest, their perceptions on what they're most concerned about in terms of climate related impacts. Most were concerned about having lack of heating or cooling, and nearly 20%, nearly 25% reported only sometimes having adequate heating or cooling. So that was something that really stood out, that there might be an issue with folks in these neighborhoods not having adequate protection from climate related heating events and cooling events and storms, et cetera. So we wanted to know a little bit about preparedness. So we asked about how prepared are you for probable impacts of these various natural hazards. So, some reported not being terribly prepared for loss of power or having lack of clean water. So all of these are interesting pilot data that are going to inform an evolution of this type of questionnaire to use in youth to really understand where their vulnerabilities are and how we can, what types of communication we can use to better prepare them. We asked about how vulnerable they thought their neighborhoods were to heat waves. It wasn't a particularly hot period, even though we were implementing this program in the summer, so that could have influenced, their perceptions on heating events. And interestingly enough, we asked about, flooding from heavy rains. And this, the implementation of this pilot predated some of the heavy flooding events that New York has begun to experience, and that began on September 9th, I believe, of 2022, and followed by September 30th of 2023, some of the main big ones. Another thing we're concerned about was, do they have an awareness of protection from climate-related events? So we asked about, is there a place to cool down in the event of extreme heat? And I don't know was sort of the predominant answer here. We asked if they knew about Department of Health cooling centers in the neighborhood. Lots of I don't knows here. So we're not doing a very good job of getting that information out to youth to begin with. And youth can be ambassadors for this information and carry it along to family and to the elderly in their environments and their communities. So there's a real potential for the power of youth having this knowledge. And of course, not to mention encouragement for them to go into fields where they bring this into, their health related professions. And then we, asked about different places that they felt they could go to cool down. So overall, results from our survey will inform educational health literacy and STEM programs for the training of our future health science leaders. And our program training satisfaction survey indicated, so this is aim 2, where we gave them trainings in the classrooms. This related to the 14 students funded by Doris Duke. It indicated that they felt empowered and they were satisfied with the training. There were several issues where students didn't feel heard in the classroom as we were dealing with some technical issues. Some students were tuning in remotely. This was during COVID. So in future studies, we'll address some of these shortcomings with more peer-to-peer opportunities and discussion and project-based learning. We did have a follow-up session this past summer just to engage them on an educational level. We didn't, do any research per se with them. It was just sort of an educational session to sort of interact with them. And the third aim, our sampling program was successful and demonstrated feasibility of using student citizen science as evidenced by the number of individual level completions of the sampling data sheet. It also demonstrates evidence of the skills developed in the classroom and how they were independently then applied by the students. So the findings from our study, we hope to inform future efforts for training and educational outreach in this population, once again, to prepare our future climate leaders. And I just wanted to remind everyone, when everyone has the same degree of protection from and resilience to climate change is our goal here, climate justice. And to acknowledge once again, Arthur Ashe Institute and our partners there, my colleagues at the School of Public Health, the student study coordinators, and our external partners on, some of the geospatial trainings and with educational consult, including Sarah Slack. And I did want to mention that Sarah Slack has, been very involved. So our 8th graders are in good hands already, where they are, doing heat sampling in their neighborhoods. They're sort of ahead of our graduate students, actually, and our high school students. It's very inspirational. There are a lot of folks out there doing great work, and I just want to learn from everyone and try and bring the message forward. Thank you.
Dr. Rao, we'll hold all questions till everybody has presented. Thank you, Dr. Geer.
Can you all hear me? Yeah.
Yes.
Thank you so much. That was so inspiring, Dr. Geer. And thank you all for having me here today. It's a pleasure. My name is Sheetal Rao, and today I'm going to talk about a survey that I worked with some people at FEMA to develop around extreme heat and occupational health. So the way that I got to work with FEMA was through the University of Colorado Climate and Health Science Policy Fellowship, in which 5 clinicians every year have the opportunity to work with a government agency, and mine was FEMA. And this was the first time that FEMA had ever worked with the fellowship. And my title was Extreme Heat Fellow. And we'll talk more about why FEMA is getting more involved in the extreme heat arena. But I also wanted to put up this group called Diffusing Disasters out of Northwestern University that I've been working with. And they are, though they're independent institutions, some of the work that I'm doing kind of dovetails together with what they're doing. So I'd like to start off with acknowledging Dr. Andy Pinart, who is the Chief Medical Officer of FEMA, and I worked with very closely on developing the survey, and also Ben Cussin-Shapta, who's an epidemiologist with FEMA. And then with the Diffusing Disasters Working Group, it's led by Dr. George Champas, who's an ER doc at Northwestern in Chicago, and Dr. Horton, who is a climatologist. I've highlighted a few names because Dr. Chan and Ashwin Sundaraj, who's a medical student at Northwestern School of Medicine, were very supportive in developing the survey. So we heard a lot about heat from Dr. Geer, and I think probably speaking to the choir here, but I just put this up. This is from the USGCRP to show that heat waves are increasing in frequency and in this length of season. And what that means for health. So these are some pictures from the Chicago heat wave of 1995. It still today remains the deadliest, one of the deadliest climate-related disasters in the US. But heat can lead to several health impacts, including cramps and going all the way from more mild to severe, like heat stroke. And the amount of the impact is going up in terms of mortality is projected to increase due to climate change. So FEMA. So let's start off with, I mean, I think, so FEMA stands for Federal Emergency Management Agency. And it might be, not everyone exactly knows what they do. Some people might have an idea. So their mission involves a national preparedness goal, which is to have a secure and resilient nation. And in order to do that, they aim to use core capabilities, which are these three red bars here. So through planning, public information campaigns, warning the public, and then coordination. And they use those capabilities in order to execute their mission, which it consists of the 5 vertical lines there. So one thing that's really important to know is that unlike floods and tornadoes and earthquakes, FEMA is, or extreme heat is not in the list of disasters that is eligible for aid through FEMA. And the reason for that is the Stafford Act. And right now there is a bipartisan bill in Congress to change that, because it would take an act of Congress to change the Stafford Act. However, it's stalled. And part of that, there are multiple reasons, but part of it is due to heat being kind of an invisible threat. It's not like the other disasters like floods and hurricanes, where it's just pretty easy and to see what the damage is. With heat, it's more of an insidious onset, and and can last longer in terms of when the damage or the peak of damage occurs. But this is a quote from Administrator Criswell, who is the current administrator of FEMA, and she's the first female administrator. So she's just saying that just because we don't have the authorities, that doesn't mean we're sitting by. So FEMA is taking action on heat, which is part of the reason why I was able to do this fellowship. So there are several initiatives and support for action on heat within strategic plan of FEMA. There's goals that aim to strengthen emergency management workforce and help FEMA to meet current and emergent threats. Also, other goals prioritize building national climate resiliency and empowering risk-informed decision-making. In 2021, President Biden has actually done quite a bit around heat, coordinated an interagency effort through new initiatives to really enhance workplace safety. And so workplace safety is what my survey is based around, but also building local resilience and addressing the disproportionate impact. And then OSHA, this goes back further, but since 1970, they mandate that every employer furnish a place of work that's free from hazards. And so that includes heat. In terms of more current actions that FEMA has taken, last year, Region 5 hosted the very first FEMA Extreme Heat Summit that I was privileged to be a part of. They included and invited all regions, and most of them were there. It's part of building relationships with local communities and municipalities, academic institutions, hence the Heat Fellow role, and as well as first responders. And then they have funding opportunities that include and highlight nature-based solutions, which also impact heat, as well as other climate disasters. They have, as well, they've been rolling out several readiness campaigns, which are around messaging and education around heat. So to delve into the survey, before we do that, it's important to understand the elements of vulnerability. In order to understand vulnerability, you have to know that it's a factor of all of these other aspects. So exposure, susceptibility, and adaptive capacity. So exposure could be something like if someone has an outdoor job or if they're unhoused. Susceptibility would be if they have chronic medical conditions, if they're pregnant or a child. And then adaptive capacity, I have my chameleon there because I couldn't find a good picture of adaptation other than that. But it's really just one good example of that is if somebody is taking certain medications, it might affect their adaptive capacity. Another example is acclimatization, which I'll talk about in just a minute. So as part of developing the survey, I had to look at a lot of literature, and I came up with a list of what I saw the most that determined vulnerability to heat. And so I want to highlight a few. So seniors is very prominent. And so I'm particularly going to highlight the ones that come up in the survey. So seniors, people with chronic conditions, particularly heart, lung, diabetes, obesity, medications, people who are outdoor workers, and language barriers as well, but there's several. So extreme heat has a huge occupational impact. Workers from all occupations or many different occupations are often exposed to higher durations and higher intensities of heat than the general public. This is due to working longer hours, often physical nature of labor. They may have to wear PPE. It could be from just being outside in the heat, or it also could be from being indoors, but just being in a kind of a low ventilation setting like a factory or this kitchen. And then older workers, as I mentioned earlier, have less physical reserves to heat, and we have an aging population, so this is a growing kind of concern. In addition, the increasing heat really it compels us to act, to plan ahead and give this issue a lot of attention. Not only is it a safety consideration, but increased heat decreases productivity, and it decreases it increases costs as well. So the projection out of the Global Institute of Labor is that by 2030, if we keep going in the direction we're going in terms of carbon emissions, we'll see in the trillions amount of economic losses due to occupational effects of extreme heat. So are there any female reservists here? You don't have to raise your hand if you feel pressured, but I was just curious if there's anyone. Pretty much anyone could sign up for this as long as you're an adult. So what a female reservist is, and I kind of had an idea, but I didn't exactly understand, but they're actually the largest segment of employees in FEMA. And they have a really important role in fulfilling FEMA's mission. They help before, during, and after disasters. So they're basically like regular adults most of them have regular jobs and some of them are retired, and they're on call. And they are, what's important to know about them, which comes up kind of when we talk about the survey, is that they're unionized. They have an hourly salary and they're paid based on how much experience they have. So if they're deployed more, they might have a higher salary. And they're only paid when they're deployed. So you can see how this could factor into kind of wanting to be deployed. And sometimes that may or may not be the best decision based on kind of their chronic vulnerabilities or health issues. In addition, when a reservist gets hired, they're assigned to one of 23 different cadres. So the cadres are just groups that they make sure that there's every different kinds of skills, and that group can just be deployed together, and that they're able to cover the needs of a population during an emergency. They go through an onboarding process. They usually receive a cell phone, a female laptop, and some training, but they are trained even when hired. The average deployment is about 30 days, and the FEMA will typically cover all their travel experiences. About a couple more minutes. Okay. So this is important, and this is why we chose, and it was really Dr. Pinart who advised that, to look into this being kind of an issue, because as I mentioned, the reservists are kind of compelled to, they're very excited, they want to help, but the average age is older than the regular non-reservist population. So that's important to know. Over a quarter are over 65 years old. So this currently what FEMA does is that they only report heat conditions that people go to the clinic for. Anything else is not included. So the problem with a lot of heat conditions is that people don't know they're due to heat. It's not always very clear in our, the way that we diagnose or the way that we report. And oftentimes heat-related conditions can present later, like they can present the next day. So what our survey does is we administer through an online platform while they're onboarding. It's voluntary, prospective, and there's demographic, situational, environmental data. They are deployed to, is only for reservists deployed to stations with potential heat exposure, and they can report their health event up to 72 hours after their deployment. So these are just some of the questions, and I had taken out a couple of them after talking to the group at FEMA, because this group of reservists is a little more uniform than the general US public. They can speak English. Their income level is a bit more standardized. And the one I highlighted at the bottom is, where do you spend most of your time? So this is just a graph that shows that people who live, this is 11 cities in the US, northern versus southern, and it just shows that people in northern cities have higher mortalities earlier on when the temperature starts going up. That's because of acclimatization. So how that is relevant is that a reservist might be deployed from Alaska to go to Florida after a hurricane, and the way that they are able to adjust to that heat is impacted by sort of where they spend most of their time. As an internist, I really wanted to highlight medications. Not a lot of people know that the medications they take can impact their health or their response to heat, and also chronic health conditions. So we made sure to put these on there. And So since we're running out of time, so what's next with this survey? So the data collection that we obtain will result in aggregated de-identified data, and it has two purposes. One is that it creates a pooled data set that will inform medical providers on site. So when those reservists are deployed, they will have an idea of who is coming. And if they see that there's a larger disproportionate amount of people over 65 or people with a lot of chronic medical conditions, they may prepare in advance with things like extra ice baths, extra cooled IVs, cooling vests, and just, more infrastructure so that they're ready for that. And then it also will be used to validate a medical vulnerability index tool. So in medicine, we use something, there's a few of them, but like, for instance, the Wells criteria is one. And we put in certain information about the patient to kind of determine how likely they are to be having a pulmonary embolus, which is a blood clot in the lung. But the important thing, and a criticism of this survey, is that we haven't weighed all the different elements that go into the survey. And that takes a lot more research to know if something counts more towards their heat impact, the health impact, versus less. And so that's part of what Diffusing Disasters is working on. And that's part of my role with Diffusing Disasters, is to do a large review of literature that's out there and kind of assign some weight to all of these things, and then use that into hopefully one day a calculator that can be used globally on an occupational scale, because this is such a growing problem. And if we could tell somebody, hey, your risk level is yellow versus orange versus green, they might have a better idea of what they're walking into and how they might maybe do an acclimatization protocol, maybe hydrate a little extra. So there's a lot of different ways that we can apply this. Thank you.
Thank you. It says 12:18, mine says 12:15. I assume this is wrong.
12:16.
Okay. The last speaker, Dr. Samtani.
A very good morning to all of you. I hope my screen is visible.
Yes, looks good.
Yeah. So very good morning to all of you. And before I begin, I would really like to thank the organizers of the Climate and Health Conference for giving me this opportunity to present my case study here. So just to give a brief introduction about myself, I hope I'm audible. I hope I'm audible to all.
Sorry, we're muted, but you're all good.
Okay, that's great. Thank you. So I'm Dr. Ratika, and I'm an assistant professor at International Institute of Health and Management Research. And basically, I'm an anthropologist by training, and my areas of expertise are into environmental health and climate change. And this is something that has excited me a lot. So before I begin, this is a very important conference that basically talks about that, yes, climate change is a global reality, and there is no denying the fact that it is changing at a very rapid pace. And the most affected are the poor and the vulnerable communities, especially. And the most affected are the poor and the vulnerable communities. And there are many barriers that exist for coping with climate change. And crop diversity is one of the most powerful ally, basically, to cope with this change. And in this regard, I'm going to focus this presentation on millets, which is a highly strategic crops for the future, just because of the fact that it is highly climate resilient. Now, how? I'll just give you a brief on that. Now, if you see this world map, the projected climate change is foreseen to have a negative impact on food security, especially in the developing countries. So if you see all the developing countries, the orange and the red marks that you can see there, it has shown there is a decrease in agricultural productivity because of an increase in temperature. So all this climate change has affected food security to a very greater extent. Coming to India, over the last 50 years, 2 different databases have shown that extreme weather events have been on a rise. And therefore, increase in temperatures, changing monsoon, and frequent extreme climatic events have affected cultivation, forestry, and aquaculture, which is a threat to India's food security. And by 2030, climate change may force many Indians into famine due to reduction in agricultural productivity and disruption in the food supply chain. If you look at this particular map, it shows that overall, India, most of the population relies on wheat and rice. And temperature increase is predicted to reduce the production of rice yields and wheat yields also. So something needs to be done. So policymakers need to consider adaptive measures to cope with the changing agricultural patterns, and alternative crops are one of the best solutions to changes to cropping pattern, promotion of water conservation, as they all have those qualities in order to combat climate change. I would like to highlight here that Orissa, which is one of the most vulnerable states in India for extreme weather events, because it's one state which experiences drought, flood, and cyclones. It has experienced 4-fold increase in droughts in the last 10 years. It has experienced almost 50% of the heat waves have occurred in the last 15 years, and that has impacted the rice crops, the rice yield altogether. This is a heat map that shows that how the state of Orissa has been the most vulnerable to heat waves. Here comes the role of millets, because traditionally in the state of Orissa and of India, many tribal communities used to grow these traditional crops of millets. But because of this change in green evolution when it came up, and because of the subsidized rates of rice and wheat that was being given to the communities, the role of millets started reducing. But now that we know that the climate is changing, the heat stresses are high, and the temperature is increasing, millets should be brought back into the public distribution system. The major reason is it has so many benefits. Biologically, it has a short cycle. It uses very less water as compared to other cereals. It has a wide genetic adaptability. It can be grown in poor soils. It is resistant to many pests and diseases. It offers a sustainable food source by combating hunger in changing world climate. It is rich in micronutrients like calcium, iron, zinc, iodine, and it is rich in bioactive compounds. It has a better amino acid profile, and it provides safety from a number of diseases, and I'll show that to you. So these are the various types of millets that are grown in India. You have the finger millet, barnyard. In fact, all over the world, 6,000 varieties of millets are grown. And they're extremely climate resilient, and they're extremely nutritious and good for and it can prevent all sorts of diseases. So India currently is facing a triple burden of diseases. You know, we have malnutrition on one end of the spectrum, we have malnutrition. On the other end of the spectrum, we have obesity, and then there are a number of people, millions of people suffering from deficiencies in essential micronutrients. Now, if millets, which were a traditional crop that were grown, are brought into the public distribution system, it has a lot of benefits. Like it helps in reducing cholesterol, it is high in fiber, it supports digestion, it supports bone health, it's rich in antioxidants, it helps reduce blood glucose level, so on and so forth. Again, these are all the different, all the advantages of millets. It has a high nutritional value. If you look at the millets versus rice, if we do that contest, millets obviously outweigh rice in many of these rich micronutrients and proteins and calciums that they have to offer. Looking into this, Orissa, the state which was being affected by so many extreme weather events like drought, like I said, it has experienced numerous events of drought in the last 10 years. Orissa Millet Mission was launched by the government of Orissa, and millets, which used to be the staple food for tribals in Orissa, were lost in translation due to modern agriculture. However, realizing its importance of highly nutritious and climate resilient millets, the government of Orissa launched the Millet Mission, and the main aim was to basically increase consumption of millets in Orissa so that nobody goes to bed with the empty stomach. And because of this Orissa Millet Mission, which was launched in 2017, it has been scaled up to 177 blocks in 30 districts till date. and it has a huge presence in the state. And there are many other states in India which are now adopting this Odisha Millet Mission program in their states as well, in order to combat hunger, which has risen because of climate change. So what are the major outcomes of this program? Increased cultivation of native millet varieties, which are climate resilient and ensure food and nutritional security for tribals. Almost 2 lakh farmers in 19 districts are involved in millet cultivation today in Odisha. Odisha Millet Mission has introduced ragi in various social safety net programs like PDS, Supplementary Nutrition Program under ICDS, Midday Meal Scheme, and tribal hostels. After the introduction of Odisha Millet Mission and its growing impact, the Government of India has asked all states to adopt the Odisha Millets Mission model for promotion of millets, pulses, and oilseeds. It is the first state to develop standard specifications for the minor millet machinery through recognized panel of experts from different scientific institutions. And Odisha is the 3rd state to distribute millets in the PTS in the country. And many Indian states have now adopted this particular program. So these are certain awareness campaigns and how the program was implemented. These are all the awareness campaigns that was in various districts of Odisha that were conducted. And this is your urban internship. A lot of competitions were conducted in various districts. Midday meals, the millets were introduced. And the way forward is introducing millets as a game changer for combating malnutrition and mitigating climate change. And if we are able to introduce millets into the public distribution system, then we might improve India's ranking in the Global Hunger Index. And behavioral change campaigns is definitely needed because India relies largely on rice and wheat. And it is very important that we need to, in order to bring millet back to people's diets, we have to enable policies and investments are needed in that area. Thank you so much.
Sort out the online questions. What do I do? Go here for questions?
Online questions. It's just-
Okay, got it. Well, I'll ask a question. How does millet taste?
I actually had it recently.
Yeah,
I read the abstract and had it on a cruise and it was fine.
yeah.
It
What,
was like quinoa.
well, I'd like to know from Dr. Samtani if was there customer satisfaction as you rolled this out?
Well, I must say one thing that though millets used to not taste that good, but there are a lot of recipes that are there on the government website. I can share some recipes with you
Please
also.
do.
And they now taste really good.
Okay, all right, yes. Dr. Geer.
To add on to that.
Yes.
Was the cultural acceptability.
Yes,
of
what
it.
was the cultural, yes, you heard that. What was the cultural acceptability of the program?
It was very well accepted because, see, millets have been the crop for the tribal populations. And the green evolution forced them to basically take rice and wheat. But somewhere, millets has been always a traditional crop for the tribal populations. So the cultural acceptability was something that the tribals themselves, they went on and promoted millets.
Terrific, Tina.
Yeah, I love this presentation. I have a question about whether there is economic pushback from the wheat and rice producers and whether anybody is pushing them
Yes.
from an economic point of view.
Yeah. Did you hear that?
Yes, that definitely is going to be there. No doubt about that, because getting something in the public distribution system, of course, is going to, create that kind of an environment. So behavioral change, changes in policy, changes in investors have to be considered in order to bring millets back to the public distribution system.
And I have a question for you. Yeah, go on.
I just listened to a podcast about another grain called fonio in Senegal, which is kind of the same story, and that they talked a lot about colonialism and how that impacted what they were growing, and what people were eating. Is that something that plays a part with millet as well, historically?
I'm not sure she heard that.
I'm sorry, I did not
Okay.
get the question.
Oh,
Can you hear me now? No.
okay, we'll write her on that. I have a question for Dr. Rao. The FEMA reservists, I believe they are, but I'm not 1,000,000% sure. Are federal government reservists like that covered by OSHA regulations?
Yeah, yeah.
So there is no heat standard right now, right? There's no federal heat standard.
Right.
So, okay, that's a critical part of the problem
Yeah.
with trying to come up to speed.
Yeah.
Can you talk about that for a minute?
Yeah, can you all hear me? Yes. So yeah, there's no federal heat standard. I know I've talked to people at OSHA that want there to be one, but it would take, again, an act of Congress and a lot of funding for that to happen.
Well, the Biden administration is promulgating one, but because of the industry pushback and sort of the congressional roadblocks that have been built up, it can take many, many years. That is a huge problem for outdoor workers, and I would assume reservists as well.
Yeah.
Yeah, okay. Any questions from the audience? Yes. Speak really loud, because
Hello, Ratika ma'am, namaste and good afternoon. I am Rajendra Gawani from Nepal. And I am also doing the same research. I am also doing the same research, but it's from Nepal, and I'm doing research on agroforestry practices for the climate change adaptation strategy. So, like Nepal and India is quite close. So I just want to know why the government, why the Odisha state is just only focusing on the wheat and millet, because there are other different alternative sorts of like agriculture patterns through which we can combat with the global impact of climate change. So why you are just focusing on the millet and wheat? Because nowadays people want to keep financially also, they want to become strong. And when there is the practices like the agroforestry practice, when you encourage people to or support people for the rural people for the agroforestry practices, I think there might be some positive impact like wheat and maize. So what do you think for the Asian countries? Do you think agroforestry would be the nice impact like wheat and maize?
Thank you. Can you answer that, Dr. Samtani? You're muted. Okay.
What I understood was sir is asking why focusing on millets, something like that, and why not on agroforestry?
Yeah, then not other form of alternative agro farms you are not like.
See, millets have been the traditional crops, and they were, like I said, they were lost in translation. And there are so many varieties of millets that can be grown in climate resilient environments. You don't need too much of water, you don't need too much of nutrition, you don't need so much work that is being done. You do, for example, other varieties of cereals, they are very much dependent on rain and things like that. But for millets, they can be grown anywhere. And a state that is fighting drought, a state that is fighting famine, if something is very easily provided and is highly nutritious, and it can help combat hunger, then that's the best solution.
Perfect. Dr. Geer, one question for you. Did you ask your students if they had air conditioning in their own homes?
I believe so. Good question.
Right. And the other question I had is you were teaching them geospatial assessment. That's primarily a computer-based training, isn't it? Or can you describe it? Because I'm not sure I understood it.
We weren't training them. We were using geospatial methods in our trainings. We weren't training them to use
To create
software package.
Because I got a lot of geospatial people in my department. It's pretty complex.
It's too.
So specifically then, what exactly were you teaching them practically?
Showing them spatial variability
Uh-huh.
and heat monitoring. Where the monitors were located, where different temperatures had been observed, and, those types of differences. Other social factors that go into the HBI, the heat vulnerability index.
Very interesting. Got that. So the final thing is they had the rage is going to be wearables, right? And environmental assessment using, can you talk a little bit about the device they created and how that's going to play into what we're looking at go in the
Sure.
future?
I mean, first of all, having them use the device is empowering. That's part of one of the principles behind citizen science in terms of, heat equity. So I think there is a larger role for actually using these devices earlier in the educational continuum to build skill sets. There are some complicated factors with using devices if they're going to measure continuously, or if you're going to turn them on for one measurement across time that can be compared across multiple students measuring in multiple locations. So, there's a lot that goes into the design of assessment that still can be worked out and improved upon. There's a great capability, and there's a software package that goes with the device that we were using that can aid in visualizations of mapping of the different results across the participants. So that part was not fully built out by us, the investigators. There's a lot of potential there. And
It's very cool,
definitely
yeah.
encourage folks in the audience who want to get engaged in that. I can share with them, the Pocket Lab weather. There's a Pocket Lab that collects different air pollution samples. So these devices are really handy and readily usable.
Very cool. Very cool. Well, thank you, Dr. Samtani. Thank you, Dr. Geer. Thank you, Dr. Rao. And I think we have lunch.
Yes.
Thank you for having me.
Thank you.
Thank you.